Hello, world. Happy Webinar Wednesday. Today, we have the great honor to have Dr. Geller with us. He's from Colorado in the United States, and he's with the Street Dog Coalition. Thank you so much, Dr. Geller. Thanks for joining us today.
Well, thank you. Yeah, thanks for having me on.
My pleasure. So, I would love to ask you, what is your story? What got you to where you are today? And just so that everybody knows where Dr. Geller is, I already mentioned Colorado in the United States, but he's also leading a massive nonprofit that brings veterinarians and physicians together across the country, across the United States, to help pets and to help the pets of the people who are experiencing homelessness, as well as for the humans themselves. So, Dr. Geller, take it away, please.
Yeah, thanks a lot. I'll try to keep this, just a little bit on the short version, so I don't go on forever. But our nonprofit provides free medical care and veterinary care to pets of those experiencing homelessness. And we have teams set up in about 50 U.S. cities right now, providing this free veterinary care through street clinics, going into encampments, big, large stand down type events or homeless connect events. And we started back in 2015. My own story was I worked 20 years as an emergency vet, and really was starting to get worn out from a lot of the stresses of working in that field. I mean, the average emergency vet usually only works about 7 or 8 years. But I found that the financial stresses were really hard on pet owners as well. Sometimes, of course, they have to euthanize their pet for financial reasons, and realize that wouldn't it be wonderful to be working in a world where no money changes hands, and we can really help people that need it. And I had an encounter, just a wordless encounter, with a homeless fellow on a bridge in Nashville with his pit bull mix, where he kind of asked me, "Hey, why don't you veterinarians all get together, and maybe some other healthcare practitioners, and maybe you can provide us some care? There's really not that many of us compared to the general population." And so I said to him, "Okay." Again, of course, we were just looking at each other and never even spoke. But we've had a lot of interest from veterinarians in doing this kind of work, and it is liberating because no money does change hands. And what we found out was that in working with homeless populations and people that are experiencing homelessness, is that their pets often provide their sole and main purpose in their lives. And we started to realize this when we realized that they're together 24/7. They also try to take really good care of their pets, and maybe even better. Maybe their pets are in better health than some of our own, or in terms of active lifestyle, being with their owners 24/7. And again, the purpose in providing purpose in an otherwise purposeless life made us realize the importance of trying to provide this care. And the other thing we noticed is that these people already have really hard lives, as you all know, and having a pet makes that life even harder. I mean, with a pet, they can't ride public transportation. They can't get in homeless shelters. They can't go into grocery stores. Can't go into doctor's appointments. So many doors are closed to them, but they elect to still have their pets with them because of the positive benefits and the purpose they provide. So we realized, hey, we can help with this, and we are as we're providing this care, we're trying to team up with other healthcare modalities, especially physicians, to try to provide one health care on the streets. We call it street medicine. At the same time, same place. We're bringing in caseworkers, of course, social workers. We have addiction counselors. Our last clinic, we had a dental team with a dental hygienist that knows about veterinary pet care as well. So she was doing dental screenings of pets and people. So that's kind of the work we're in, and we're hoping to recruit more folks into it and see where this journey takes us.
So you have 50 veterinarians working with you in one way or the other. When you started, did you ever think that you would get to that special number?
No, it wasn't really a goal. The goal was because I live in Fort Collins, Colorado, which is the home of Colorado State University, where I graduated. I've lived here in the same house since I went to vet school quite a while ago. But our plan was to do this work here locally, and just kind of a change of pace for me to get, especially from emergency work. And I love the idea of doing street medicine too, because you have to kind of MacGyver things and figure things out, and also get you back to a very hands-on approach where, we have to have our X-ray vision since there is no imaging center, there's no imaging department to send the pet to. Same with laboratory stuff, and just talking a little bit more about street medicine that way. The history becomes so important, and the physical exam becomes so important, and especially for students and veterinary students, those pieces are kind of being overlooked a little bit in vet school these days, because they tell me that, and I see it in how they're doing their exams. So it's kind of back to basics. So the medicine part of it's really fun, and most of the veterinarians that have joined us have just heard about the work that we're doing. They wanted to do something similar. Most of them are working veterinarians, but recently a medical school, Colorado School of Medicine, opened up in Fort Collins, where I live, and so now medical students are also rotating through our weekly clinics that we have with Colorado State fourth-year students. So we're kind of creating a laboratory of One Health, and seeing what works and what doesn't.
Mm-hmm. Excuse the cat.
Of course.
He hopped up again. So there was a lot that was covered right there. So it sounds like it was a word of mouth movement.
Mm-hmm.
So you were just, how did it really spread? Because 50 is a lot.
Yeah, I mean, with the help of our mutual friend, for example, I have been getting to speak about it at some conferences. And so I've done some really direct recruiting that way. And then vet students really like hearing about this stuff too. And we've had some recent graduates that have said, I want to set up a street medicine team where I'm at. So we have folks that are just a year or two out of school that are doing it too. So AVMA has given us some really good support, because I think they also, access to care is a big topic. Mm-hmm. And I think that the topic mostly applies to the millions, tens of millions of low income folks that are pet owners in the United States. And they're struggling with, try to make things work. But most of the programs that are out there right now do require you to have some funds to put in, for a sliding scale, for like a program like Align Care.
Right.
Where you can maybe make a small payment. But for folks that are indigent and have no money, there's nothing. So I guess we look at ourselves as kind of a safety net, and other veterinarians see the same thing. I mean, you can't go to a city without seeing people camped on the sidewalk, and a number of them have pets, depending where you are.
Right. And for our viewers, the AVMA means the American Veterinary Medical Association. A lot of word of mouth with a lot of veterinarians, vet staff, vet technicians and such. How about on the human side? How about with the physicians, the nurses? Have you had much experience? And if so, what's the reaction from them?
Yeah, so that's kind of where we're at right now, is trying to create these partnerships, these unofficial medical healthcare partnerships. And physicians, I think I've been somewhat dismissive of the efforts and impact of veterinary medicine in general. But as we're out there working on the streets, and in some cases now side by side with them, with their street medicine teams, they're seeing that veterinarians and veterinary personnel, technicians, assistants are able to more quickly establish trust with a population that's generally pretty distrustful of anyone wearing uniform or scrubs, or might represent authority. And we're out looking at veterinarians as kind of providing a bridge to openness to other healthcare by kind of establishing this trust. And that's the model that we're working with on the streets. And I think physicians are starting to appreciate that opening as well. And also the issue of zoonotic disease, where people are with their pets 24/7. They're sleeping with them, and often with bedding that maybe hasn't been changed or hasn't hit a laundry machine ever. And we're seeing things like ectoparasites like mites causing a problem, and sometimes some other zoonotic diseases that can be transmitted. So there's an increasing appreciation of work of veterinarians by human healthcare providers. And I see these partnerships starting to strengthen and happen more frequently.
Fascinating. Well, I'm really happy to hear that. That's wonderful. And have you had much experience yet with other community groups that are focused on the environment, like providing clean water, accessible water, or you mentioned the bedding, of course, and that plays into the environment. Any other stakeholders, any other community members you've been partnering up with?
Yeah, I mean, we're looking at doing this, taking a really large van out into rural areas. And one of the ideas was to maybe even bring a water testing group with us, water and air testing in some of these smaller communities that are overlooked often in terms of kind of environmental health issues. So we are trying to combine that. And One Health is such a big topic that it's easy to, it's hard to include everything, but we are trying to address that. And of course, in the cities, quality of drinking water can still be questionable for sure. But I think some smaller communities where there's been industrial pollution, for example, and mining, and et cetera, that has been overlooked, is an important place for our efforts.
Right. Well, it's really good to hear that that's on the horizon, that type of monitoring and that type of collaboration. I think that's incredible. And I would love to hear an update after that actually happens with what's found and how the community responds to that joint effort. That's wonderful. For right now, and for the last several years, it seems like veterinarians have been the ones who talk about One Health the most. Do you feel with your experience that there's more buy-in from people from other sectors, other disciplines? Where do you see the future of One Health?
Well, I see caseworkers and social workers really, and folks in public health are really getting interested in this topic. And I think they'll be the kind of the next ones uh, to bring it on board, where we're trying to, and it's also important for veterinary students, and hopefully at some point medical students and social work students to uh, be talking about this and discussing it. And then we do work with a lot of students in those schools and try to get those professional students together to do some One Health explorations at their level as well. So I think the pressing need, is One Health on the street, and that's what we're doing. It's just hands-on. We're going to go out and do these street clinics, and we're going to do them right now. And we're really hoping that folks want to get involved in a hands-on way, because we can talk about these issues a lot, but at some point you want to see some action, something happen. And so it's going to be interesting to see what happens, especially from an international perspective, where animals and pets play a different role, obviously around the world, in different diseases. And thinking about something like rabies, such a huge topic, but even in the United States, if someone has a pet that hasn't been vaccinated for rabies, even though the risk is very low in the United States, it becomes a kind of a legal and financial nightmare for them if that pet happens to bite someone, which we've discovered. For example, that pet is supposed to be quarantined. Well, it can't be quarantined if the person doesn't have a place to quarantine it, i.e. a home or a house. So they get quarantined at a shelter, and then they have a bill for $250. They can't afford to pay it. The pet either will be then surrendered and adopted out, potentially euthanized. So these are all tough little dilemmas that we have to address.
Right, right. So if somebody wants to join the Street Dog Coalition, how do they do so?
All they need to do, if they type street dog into their search engine on a computer or a phone, there's a good chance the Street Dog Coalition will pop up. There's other groups as well. And I think we have a very informative website with a lot of pictures also, and showing you different cities, what's going on, calendar of events. And so if they're in a city where there might be an event, they can actually volunteer at that event. They just have to send us an email, which is linked right to that website.
Wonderful. And something that I really appreciate what you said was the importance of social workers. I've been saying this, I've been thinking this for a very long time, but nobody's saying it. Social workers are vital to the One Health message out to the public, because
Yeah, they're the ones. Yeah, you're exactly there. They become
advocates.
advocates for these pet owners, and we kind of call what we're doing is taking care of both ends of the leash. And over time, we're kind of moving up further and further toward the human end of the leash, because there are so many needs there that aren't addressed. And I mentioned dental care was one of them. We just recently discovered, and we realized, well, wouldn't it be great to have a veterinary and a human optometrist doing vision screening for those pet owners, and getting them glasses, and doing hearing screening with an audiologist, and getting some hearing aids, because folks, again, the deck is stacked against you if you are living on the street with a pet. And so anything we can do to make that work out better, and really even folks without pets, we can help them as well. And obviously the social worker can take on that role.
Wow. Such inspiring words there. Do you have any advice for young future leaders in the One Health movement?
I think just for an eye-opening education, I really think start to study what homelessness looks like in your region, because it is a worldwide issue, and it can look very different. And so exploring it means everything from with a buddy going into some encampments, and maybe just talking to people. I mean, usually, at least in the United States, you have to be ready to chip in a few bucks if you're going to talk to folks, and that's expected. But just to get some comfort level with with what conditions are like on the streets for those that are living outside. And then the ones that have pets, especially if you're interested in veterinary medicine, that gives you a good conversation piece right there, is talking about their pets because they care about them so much. And so learning everything you can about, the topic of pets and poverty, I think would give you the good tools and then maybe move on, to be a volunteer, although you could probably do that right now. So volunteerism and education, which is I'm hoping where maybe you come in too, would be a great starting place.
Yeah. Yeah. Well, thank you for saying that.
Sure.
It's been a pleasure, Dr. Geller. Thank you so much for your time and for just, oh, my cat says thank you as well.
Okay.
So thank you very much for your time and your dedication
You're
to
welcome.
the communities experiencing homelessness of all different species. So keep
Well,
great work.
no, thanks a lot. I'm having a good time out here, and I really appreciate connecting with you as well.
Well, thank you. I'll see you next week, everybody. Onwards and upwards. Bye.